Hello, and welcome to Glanbia's Dairy Focus. In this episode, I would like to focus on increasing cell count that you may have noticed on your farm in recent weeks. Some of our herds will have seen a gradual increase in the somatic cell count of the bulk tank since sort of the start of May, middle of May. Now, for a small proportion of our herds, the ones that have an autumn calving herd, this could very well be the natural occurrence of autumn calving cows coming to the end of their lactation and soon to be dried off. So once those animals are dried off, the bulk tank cell counts should really improve again. But for the vast majority of our herds that are spring calving only, this has over the last few years maybe been accepted as a normal progression, but it shouldn't be. And an increase in cell count for many herds means that there is an increase in mastitis. Not necessarily more cases of mastitis, but certainly an increase in subclinical mastitis. There could be other stressors that drive up cell count, and anything from an IBR infection going through the herd to cows moving into a new milking parlour or changes in the nutrition that can create a stressor for the cows that will also increase their cell count. But once they get past that stress period, the cell count again should settle down if it's not being caused by a mastitis infection. Now that's a very individual herd scenario, but we know that for most of the herds that are experiencing a creep in cell count, that this is indeed because of mastitis. Now controlling mastitis always goes back to the basics, and the start of that really is the cleanliness in the parlour. And it starts with your own hands, because in the parlour there really should be only two things that will touch every cow's teeth, and that is the milker's hands and the cluster liners. If you're using paper towel or anything else to clean the teeth, they should be single-use dry paper towels. Don't use any other type of rag. And once you've used the paper towel on one cow, discard it. Get rid of it. Don't reuse that paper towel. So that ultimately it's your own hands, where you should be wearing single-use latex gloves, and if they are torn during milking, you should really replace them with a new set of gloves. As long as they're not torn, try and keep them clean. Maybe use a bit of teeth disinfectant or peracetic acid, but something to keep them clean during milking. When it comes to the cluster liners, the magic number is 2,000 milkings. And this is repeated over and over, that you really should change your cluster liners every 2,000 milkings. Now what does that mean, every 2,000 milkings? Well, a simple example would be in a 100 cow herd that milks twice a day on a 10 unit parlour. Every unit goes through 20 milkings per day. So to get to 2,000 milkings, that would mean only 100 days are needed for that parlour to get every unit 2,000 milkings. 100 days is only 3 months. We know that the vast majority of dairy herds in the country are not changing their liners frequently enough. The standard protocol of every 6 months may not be sufficient for your herd. Maybe the herd has grown in the last few years and the 6 months is not sufficient anymore. And herds that may only change their liners once a year are completely inadequate. So do the calculation for your own herd and make sure you change those cluster liners frequently enough. The reason you should be changing the cluster liners is very similar to why we wear gloves. It's not just about cleanliness. It is also that latex gloves or fresh rubber liners do not harbour bacteria as well as your own hands do, or the more worn rubber. And after 2,000 milkings, the rubber does start showing very tiny little cracks in it and becomes more rough. Even though when you feel it, the rubber feels quite smooth still, it is rougher than a new liner. And the best cluster flush system in the world will not be able to get rid of the bacteria that are trapped in the little cracks in the rubber. Now when we're talking about maintenance to the parlour, it's not just about the cluster liners being changed, it's also the rest of the plant. Excess vacuum or prolonged milking time, where the cluster stays on the cows for too long because maybe the ACR isn't calibrated well enough, or you don't manage to get back to a cow that's been milked out quick enough, will have a huge impact on her cell count and her ability to fight off infections. See, cows that are exposed to excess vacuum or fluctuating vacuum, or cows that are overexposed to vacuum because they're being milked when they're already empty, will change the teats, and especially the teat end. When the teat end starts changing and show a bit of roughness or thickening, again, bacteria can be harbored in there that will not get rinsed out or disinfected by teat disinfection. So it's important to keep on top of your parlour maintenance to make sure that the cows are not being exposed to any faulty vacuum or over milking. On the teat disinfectants themselves, always go for the top quality teat disinfectants. Chlorhexidine is probably the best disinfectant we can currently get for our teat disinfectants. So try and find a teat disinfectant that has the highest concentration of chlorhexidine. When you are using a teat spray, make sure that you use 15 ml per cow per milking. When you're using a dip cup, 10 ml per cow per milking should be adequate. The 15 ml should go onto the teats, obviously, not just on the udder as a whole. And you should try and cover every teat, every milking, but also every side of every teat. And you can easily check this by wrapping a bit of paper towel around the teat after it's been sprayed, and you will see that any dry patches on the paper towel are parts of the teat skin that have not been covered. Try and do the teat disinfectant as quickly as possible after the cluster is taken off the cow. The longer you wait, the more of a head start you're giving the bacteria in relation to the disinfectant. If you can, an ideal way to control the spread of mastitis in the parlour is segregating out your cows that are causing you trouble. Your high cell count cows, the cows that you know are harbouring bacteria, the cows that may be under treatment already. If you can't segregate them out and milk them last, you still should be very well aware of which cows they are. Now this can be as simple as using a California mastitis test, a paddle, and finding out which cows have a high cell count quarter. You may then select to treat those quarters, obviously, but it's important for you to know that when those cows are being milked, that cluster needs extra attention before it is placed onto the next cow. And that could mean using a dipping cluster technique with peracetic acid, for example, or rinsing out the cluster. Another good way of finding out which cows are your troublesome cows is obviously carrying out milk recording. And at the moment, a mid-lactation milk recording for your spring calving cows is ideal to get a good handle on not just the cell count and finding out which cows are high in cell count, but also getting an accurate measure on mid-lactation milk constituents production and getting a good prediction of the full lactation production potential of those cows. Doing a milk recording will give you a wealth of information on cell count and will easier to monitor the dynamics of cell count within the herd and if your protocols that you are using are being successful. It will also give you a list of your problem cows. And those are the cows, again, that need extra attention during milking itself to make sure that they're less likely to spread the infection, but also to target those cows to do a culture and sensitivity test on. The culture and sensitivity test is done on the highest cell count quarter of your highest cell count cows, especially new cows with high cell count. So new cases of high cell count in the herd, which you can identify based on your recent milk recording report, will give you the best chance of finding what bacteria in your herd are causing mastitis. The sensitivity testing of that part of the culture and sensitivity testing will also identify which are suitable antibiotics to treat the mastitis in your herd, and whether that is for a lactating cow mastitis treatment or whether that is for the dry cow treatment that you're selecting to use in a few months' time, it will be very valuable information. Doing the basics right will give you a good handle on your cell count in your herd. Now there are some very herd specific scenarios where even if all the basics are perfectly managed, cell count is still causing an issue, and that needs to be further investigated. AHI has some really good guidelines on their cell check program. But even when you go onto Glanbia Connect, you will actually find a cost calculator of how much is it costing you with the cell count that you are currently having. How much profit are you missing out on purely because cell count is impacting the milk production in your cows? And controlling cell count now will allow your cows to have an improved production and a better milk production longer into the lactation. It will set them up better for their dry period, and it will give you a better dry cow treatment success over the next winter. If you want any more information on this topic, please talk to your local Glanbia representative or log on to glanbiaconnect.com.